Earlier today, drug maker Pfizer announced that its COVID-19 vaccine is more than 90% effective. After testing tens of thousands of volunteers, Pfizer and BioNTech plan to submit an application for emergency use authorization from the FDA later this month. The company says it's waiting for some data to meet safety criteria before moving forward with the application. Meanwhile, the United States is set to become the first country in the world to surpass 10 million coronavirus cases. There have been more than 237,000 COVID-19 deaths nationwide since the start of the pandemic. For more on the coronavirus pandemic, let's bring in Dr. Ron Elfenbein. He's an emergency care physician and author of Surviving Coronavirus, an ER Doc's Perspective. So, Dr. Elfenbein, Pfizer is saying that its COVID-19 vaccine is 90% effective. What do you know about the trial, and what's your reaction to what the company is alleging or claiming?
Well, good morning. It's fantastic news. The trial was actually, so the Pfizer vaccine is a 2-dose vaccine, and the trial used essentially roughly 43,000 plus participants over the last couple months. And the reason that they're going to be applying for the EUA at the end of November is because the FDA requires two months worth of data, and they don't have that yet until the end of November. So the third week in November is the first day that they'd be eligible to apply for the emergency use authorization. So just to speak to that point, so the vaccine is actually, the initial data shows that it's greater, as you said, Vlad, greater than 90% effective at 7 days after the second dose, which would put it, but basically at 28 days after the first dose. So essentially, you get your first dose, then you get your second dose, and within 7 days of getting that second dose, the preliminary data shows it to be greater than 90% effective. Now, I would like to caution that this is preliminary data, and we don't know where it's going to go as we get more information. And the other thing is that this has not been peer reviewed. So this is just Pfizer saying this is their data that they have. It hasn't been looked at by scientists. It hasn't been looked at by peers. And it hasn't really been scrutinized in any real shape or way yet. But, it's a huge glimmer of hope, and this is fantastic. And I just want to put this into perspective that, the annual flu shot is only about 40 to 60% effective. So if you're looking at a vaccine that's about 90% effective, this is a huge, it's not even a home run, it's a grand slam. And initially the FDA was really only looking for 50 to 60% effectiveness. So if it's truly 90%, this is just out of the park. This is fantastic.
So what does this mean in terms of a vaccine being approved? Where do we go from here?
Yeah, so as I said, it has to be they have to submit the data at the third week of November to the FDA for approval for an emergency use authorization. That'll take a couple of weeks probably before they can give that. At that point, more data will have come in, and hopefully the study will have been peer reviewed. And once that's done, my understanding is that the federal government will begin distributing doses of the vaccine. Now, the executive branch has been very, very smart in that they've encouraged the vaccine manufacturers to stockpile doses, even though it hasn't been approved yet. So they're already going to hit the ground running. They already have an undisclosed number of vaccine doses kind of in waiting. As soon as they get that EUA, they can start distributing them. They don't have to necessarily just start making them. They've already been doing that. So, and in the hopes that they're going to get an EUA and that they're going to pass scrutiny. So that was very, very smart on the part of the Operation Warp Speed and on the part of the vaccine manufacturers to do that. So they already have all these vaccine doses waiting. So as soon as they get that EUA, these can be distributed and start getting into people's hands.